Welcome back to the Ultraviolet Tide. Thank you so much for joining us for another week of the podcast. Today, I am very excited for this episode because we are sitting down for a conversation with Dr. Aleksandra Brown to discuss ways to love your skin in preparation for Valentine's Day. Dr. Brown, welcome to the podcast.
Thank you. And thank you so much for having me.
Absolutely. We're super excited for this conversation. And I wanted to get a little bit into your background to share some insight with the audience before we really dive in. So Dr. Brown was born in Bosnia and Herzegovina and came to the United States as an exchange student in 1999. She decided to pursue a career in medicine after working in a hospital emergency room as an undergraduate. She earned her DO from Des Moines University in 2009, where she was awarded the Academic and Service Excellence Award for outstanding academic and interpersonal leadership. She lives in Blacksburg, Virginia with her family and is fluent in Bosnian, Serbian, Croatian, in addition to English. Dr. Brown is also board certified by the American Osteopathic College of Dermatology. She is a member of several medical groups, including the American Academy of Dermatology, the American Osteopathic College of Dermatology, the American Osteopathic Association, and the Virginia Medical Society, which is quite a resume. And she joined River Ridge Dermatology in 2013. Dr. Brown, can you start off by sharing a little bit more about yourself and your background? I know you have a very impressive resume.
Sure. Thank you so much for that introduction. Sounds pretty cool. It doesn't feel like it. It just feels like I've always been here. So as you said, I moved here when I was 18 as an exchange student, and I decided to go ahead and stay in the country. Went to college, medical school, dermatology residency as well. And then I'm currently full-time at River Ridge. I'm also full-time clinical faculty at Lewis Gill Dermatology Residency, as well as associate clinical professor at Virginia College of Osteopathic Medicine. And I just recently was asked by the University of Virginia to take their dermatology residents for cosmetic lectures, and I've accepted that. And they're working on getting me associate clinical professor at the UVA. So lots going on. I've also served on Virginia Derm Society board meeting for a couple of years, and that was really nice when the society was just started back up. But I'm no longer involved with that just because of everything going on.
Yeah, it sounds like quite a lot. Absolutely. And little known fact about me, even though Snigdha and I did go to Virginia Tech, I actually grew up in Charlottesville, Virginia. So I have a very strong tie to UVA.
Yep. Their derm residents are supposed to start coming next month mostly for cosmetic stuff.
Okay. Oh, that is so exciting. A lot going on. And what I really wanted to get into in this episode is, like we said, Valentine's Day is right around the corner. So we thought it would be really fun to do an episode surrounding tips for loving your skin. Obviously, as a sun protective apparel brand, we preach far and wide into anyone who will listen to get a skin check. And I know that's something that you preach as well, that skin checks are so important. And maybe if someone's listening who has never gotten one before and know they should, but they just feel a little anxious and they are trying to gain courage to go do it. Can you talk a little bit about the importance of a skin check and why people shouldn't stress about going in and taking charge of their health?
Everyone's pretty anxious about skin check. As a matter of fact, women will come in and they'll tell me that it's more uncomfortable than a gynecology exam. And really it shouldn't be. I think that they're just so uncomfortable because we're going to look everywhere. Your clothes is off and it's, there's another person looking, and I often have a medical student or resident with me and things like that. But we have to remember is we do 20 to 30 skin checks a day. To us, it's routine. There's an order we go in, and every dermatologist does it a little bit differently. So some things you should expect during a skin check, you're going to be checked in, medical assistant or nurse will take you back to the room. They'll take your history and confirm everything, and then you'll be left with a gown. You want to put your gown on, open it in the back, and just relax. We do this all day, every day, multiple times a day. Even though you're uncomfortable, we are very comfortable, and we're going to do everything we can to make you comfortable. Couple things to think about when checking skin. It's ideal to come with no makeup on. It's ideal to come with no nail polish on. Just because we can't see everything properly, we might be missing some things if we can't see very well. So removing makeup and removing nail polish are very important. That being said, moisturizing is totally fine. If you just showered and your skin is dry, moisturizing afterwards, and definitely applying daily SPF on your face. And I would love to get into that at some point today as well. You can certainly do those, even if your sunscreen is tinted, just enough to protect your skin. We can see through that, but preferably no makeup or nail polish.
Yeah, that's something we always try and remind people is if you have nail polish on, you can't see the actual nail, especially if, you're someone who maybe does get frequent gel manicures. Snigdha and I were talking about that last week in an episode that gel manicures, they're starting to get research about that and the potential risks. So especially if you're one of those people who gets frequent gel manicures, if you're wearing nail polish, you can't even check the butt of your nails to see if there's any kind of risk. And I always say, it is best to just go in, trust the experts, and just try not to feel awkward and uncomfortable about it. Just know that it's something that you have to do for your health, that it is maybe 10, 15 minutes. I know my skin checks have been very, very quick. Snigdha, I don't know about yours as well, but mine have always been very efficient.
Yep. I grew up in a community that didn't really focus on skin health and sun safety and stuff like that. So I recently had my first skin check, and I'm 24 years old, which is really sad, but better late than never. Mine was quite fast and very painless. They didn't find anything of concern. So that went well.
I actually think you're doing great at 24. If you look, American Academy of Dermatology guidelines don't even recommend a skin check till 50. I kind of disagree. I think if you're 30 and it's 2023, if you haven't had a skin check, make this the year to get one. Make your New Year's resolution. New Year's resolution for everyone in their 30s this year should be get your skin check and find that sunscreen that you like for your face and just apply it to your face, neck, and chest and hands every single day. Those are two very simple steps that can be life-saving, really.
I absolutely agree. And we always tell people that, especially if you have a family history, there is no downside in going in your early 20s. I know we have some ambassadors that had their first melanoma in their early 20s. And if they weren't taking, those steps to take charge of their skin health, it could have really progressed to, stages beyond 1A, 1B. And some of the cases have. So we always tell people, especially if you have a family history, and you guys are hearing it from a dermatologist here, that the earlier, the better. That you don't have to wait, especially if you want to take charge of your skin health.
And I would say, whatever age your family member was when they were diagnosed with melanoma, take away 10 years, and that's when you should be at the office.
Oh, interesting. I love that. That is a really good tip. Yeah, I know my mom, when she had her melanoma, my entire family went for skin checks, just for peace of mind. We definitely didn't grow up, not wearing sunscreen. Like, we always wore sunscreen. We were always seeking out shade. We were always very, very cognizant of the sun, but we're also blonde hair, blue eyes, very pale skin. My family's Irish, so we're very, very pale, and very prone to burning. So that's a wonderful tip. So family history, all that fun stuff.
And speaking of genetics and melanoma, there are tests now that we can do for test whether or not you carry, carry the gene. And these are blood tests, so they're pretty simple to do.
I always feel like that's so important. I know my mom did genetic testing, and it's one of those things that when you're going through melanoma and skin cancer treatment, maybe you're on the other side of it and you're just not sure of what future risks look like. Doing tests like that give you back some peace of mind. So I think from the perspective of that as well, taking back a little bit of insight and authority is always helpful for people as well.
Mm-hmm.
So you mentioned daily SPF, and this is something we always tell people: on your face, rain or shine, snow, whatever the weather is, you need to be wearing a daily SPF. Can you talk a little bit more about that?
Yes. So daily SPF on sun exposed sites, and that's different for everyone, but at least cover your face, neck, chest, ears, hands. I do my face and neck and chest every single day. And then I get things like, I don't like sunscreen. It burns my eyes. My skin is sensitive. I can't tolerate it. I personally have very sensitive skin. I have rosacea, which means your skin is not going to tolerate a lot of chemical sunscreen. So this is a perfect time to talk about difference between a mineral and chemical sunscreen and how do you pick the one that you like. So when I see patients, as soon as I'm done with a skin check, my question is always, do you wear sunscreen on your face every day? And they're like, well, it's in my makeup. Well, do you wear makeup every day? No. So probably need something underneath. That's my one pet peeve. You can't count on sunscreen in makeup because most of us don't apply makeup enough. Mm-hmm. So you really need an SPF underneath. Then they want to know the brand and the number, like what percent. It's really not a percent, it's an SPF. And it should be at least a 30. 15 is really just not enough. It should be at least a 30. I'm not picky on the brand. My rule is wear it every day. You have to like the way it feels on your skin or you're not going to do it.
Yep.
So as long as you find something that you like the way it feels, it's not important what brand it is, as long as it's SPF 30 or higher. And then you want to look at the ingredients. So it comes down to two different categories, mineral and chemical. So mineral sunscreens are things that have active ingredients listed, such as zinc oxide and titanium dioxide. Those tend to sit on the surface of the skin and reflect the UV light, so they don't create a lot of heat. They're ideal for patients with rosacea and melasma because both of those conditions can be flared with heat. If sometimes, however, they will be a little bit thicker and white depending on what brand you get. So some patients don't like it. If it's not tinted and you're darker complected, you're really not going to like it. Speaking of tinted mineral sunscreen, if you have melasma, sunscreen that is mineral, meaning zinc and titanium, and has a tint is preferred for you because tinted sunscreens have iron oxides, and iron oxides do a much better job reflecting UVA and visible light, which will flare melasma.
Oh, that's so interesting. Yeah. And I think people ask us all the time, is there a better one, mineral or chemical? And I know some people have a preference, but what we always tell people, and correct us if this is the wrong thing to tell people, is you just have to find something that works for you. Because if you go for one versus the other and you don't wear it, then it's not doing you any good anyways.
Exactly. And if you have sensitive skin, you're probably more going to be up to use mineral sunscreen. Now, if you don't have sensitive skin and you want something really light, really easy, simple, any chemical sunscreen will be fine. All of them now have the active ingredient of avobenzone, which will block UVA and UVB. And most of them you want to look for octocrylene. Octocrylene is a stabilizing agent for avobenzone so that sunscreen lasts longer and you don't have to apply it as often.
Oh, that is huge for people listening who have kids who try and chase them around to reapply sunscreen.
Yes. Yes, I have kids too. And for face, we like sunscreens with zinc. So we use LTMD UV lotion a lot. My kids are very active. We're outside a lot. Now, if it's beach or pool for the body, and LTMD UV lotion does have zinc in it. So I like that for their face, ears, neck, and things like that. But if we're outside, beach and things like that, then here lately our go-to has been Coola brand. And I do use chemical in them, but I'll apply a lotion first. And then every 2-3 hours, I'll go with the spray sunscreen. And you really have to spray enough and close to the skin to see them kind of glisten from that oil on them. And then they just have to let that absorb.
Yeah, I feel like that's a huge thing with spray sunscreen. I see people just go zoop, 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 and then they get into the pool. I'm like, wait, no, you're not ready yet.
15 minutes. You have to wait 15 minutes.
Yeah.
And we always apply sunscreen before we even get to the pool. So we'll apply sunscreen, put our bathing suit on, then we're heading to the pool. We'll reapply every couple hours once we're there.
I totally agree with applying before your bathing suit. I always tell people that I do this and I sometimes get weird looks. I'm like, well, your bathing suit moves around. Like if you're swimming, if you're moving around, your bathing suit's moving. So it's not really protecting you. And especially for, bathing suits that might not have, any kind of sun protection, some of those center materials, it's not doing that much anyways. And I promise you, you do not want those sensitive areas of you burnt. It would not be comfortable.
Yeah.
So we talked a little bit about Alta MD. So that's one super popular sun protection brand, sunscreen brand. I personally use them. I've used them since high school. I think their products are amazing. Do you have any other, maybe even sun protective apparel brand products that you like, SPF products that you like? People are always looking for recommendations.
So my go-to sunscreen, and my entire staff knows this, for my face is River Ridge Dermatology brand Glow Tint. and it has zinc, titanium, and it's tinted. I don't know how to apply foundation for the life of me. I've never learned that. You're supposed to blend it and where you stop and match it. So I've never done that. This has just enough tint to give you a little bit of coverage, but not bad. So for SPF for face, that's my go-to. Or L-Tamed UV Clear is very, very nice. Probably the best-selling sunscreen in the country. Now, when it comes to UPF clothing, I'm going to say this right now. It is way more efficient than any sunscreen, period. Okay, it's just going to be, it protects way, way better. You can have a shirt that claims to be UPF 50 and put a sunscreen on that's SPF 100, and you will still tan through the sunscreen and you will not tan through the shirt.
Mm-hmm.
Every time you tan, those skin cells are mutating and you're increasing risk of skin cancer. It's not just sunburn. Chronic tanning will increase risk of skin cancer. Look at farmers. They're outside all the time. They don't burn. They have what's called hardening. They've gotten used to the sun. So they're not likely to burn, but they're going to tan. And guess what they do when they get older? They grow basal and squamous cell skin cancers. Okay, so UPF clothing is more effective than any sunscreen, even if applied every 2 hours. For example, we were just in Aruba at a conference, and my daughter, my kids, and I, and my husband, we all tan really, really easy. But she had a shirt that kind of was a little bit shorter. I probably need to get a new one, so it covered to here. And she's religious about sunscreen. If I forget, she'll put her stick on, very religious. Well, at the end of the day, there was a little tan line where her hand got darker, and this did not. So the next day she wore her SPF shirt that had like a thumb hole and covered everything because she really didn't want her hands to get in the sun. And we use great sunscreens, and she did fantastic reapplying. And this just proves that any shirt you can put on is so much more protective and so much easier if you have kids. But
Yes.
even personally, so much easier.
100%. And good for her for already taking sun health so seriously and remembering to reapply herself. That's very impressive.
She takes after me. She's been to the office and really enjoyed watching skin cancer surgeries. She's only 10. She just wanted to watch. So I think that kind of made an impression on her, which is hence the sunscreen and SPF shirts. And really, SPF clothing is not what it used to be. Like 20 years ago, they were stiff. It was hard to get in. There were solid patterns. There were solid colors. You can get pattern. You can get ruffles. You can get a cute hat and a gaiter to match. Like, it's a whole outfit now. And you can look cute and be protected and not worry about, did I reapply? Is that sun hitting in the wrong angle? Did I get it right behind my ear? Did I cover my neck? Like, you don't have to worry about it. You just throw your UPF gear and off you go.
Yes, it's like one of the huge benefits that you don't have to stress about it. And Snigdha and I always tell people we're designing clothing that should be incorporated into your life seamlessly. I know, Snigdha, that is something that we preach high and low, that these pieces should be incorporated into your everyday life seamlessly.
Yeah, and I think we took that into account when we designed our All-Star tennis dress. I mean, I'm just waiting for the warmer weather just to talk about that dress.
I have got to talk about that dress, you guys. So I have the black, and I need to get more colors. You guys nailed it. The material is soft, stretchy. Yay. The dress has pockets. These are all like, and I wear a lot of dresses. Now, another thing where you really, really, really nailed it, I'm 5'1". So when I buy those, I'm like, oh, here we go. It's going to cover my knees, make me look so much shorter. It didn't. It was well above my knee. And I went to the conference, and that black, I wore it to breakfast. I wore it part of the lecture. I wore it out to like a casual dinner, and I wore it to the beach. That dress got worn the whole week, entire week. It washed wonderfully. I love it. I need more colors.
Oh my gosh, that makes us so happy. Snigdha and I took months designing that dress. We were polling our audience. I mean, Snigdha, how many polls did we do about that dress to try and get it right?
Countless. I don't have a number. I mean, there were days when we would be on Zoom calls. I mean, this was during COVID, obviously. So like, we're sitting there like, oh, the neckline doesn't look right. The armholes are a little too big. It sits a little too far down on the leg. It makes me look a little old. So we're going to bring it up above the knee. So that worked out. But yeah, lots of listening to feedback. And
you nailed it. The collar's high enough, but not too high, because sometimes if I wear some shirts and it's like hitting right here, I'm like, I can't even move. The V-neck is just enough to make you feel comfortable but not feel like things are out. Armhole is perfect and it's soft. Pockets, my phone even fit in the pocket. and it didn't fall out when I was walking on the beach.
Oh my gosh. This makes
So
me
that
so
angle
happy.
must have been just right, because sometimes, you have a pocket, but the foam falls out.
Uh-huh.
Nailed it. And it's
Oh my gosh.
stretchy. It is so stretchy and butter soft.
It's so
I love
soft.
it.
So
That
soft.
fabric is my absolute favorite. I know when I got the samples for that fabric, I'm like, all right, this is it. Snigdha, this is the dress. And she's like, wait, we haven't even seen. I'm like, nope, this is it. This is it. Oh my gosh, that makes me so happy to hear that you love the dress and that you were able to wear it to a ton of different events. So that's exactly, I wanted a piece that I could not just work out in, because I feel like there's a ton of sun protective apparel that you can work out in, but there's not a lot of pieces that can go with you from event to event to event. Like I wanted a dress that I could wear to brunch, I could wear on a walk, I could wear playing tennis if I put spandex underneath it. I mean, another thing we polled the audience on was whether or not they wanted spandex underneath it. And everyone said, no, I don't want it built in. Snigdha's sister is even a tennis player, and she said, it's just not comfortable. We even cut out the spandex from some of our products because they're not comfortable. And also spandex is hard to fit to everyone. Everyone has different kind of comfort levels when it comes to how tightly and how loosely they want things to fit. So it makes me so happy to hear that you got to experience the exact use case of what we were hoping for the dress.
And, it feels thicker than some of the other brands I've tried. So I was kind of nervous that when I went out there, I would get hot. It was 85 degrees whole week. I wore a black dress midday and I was not hot. So somehow it breathes and it keeps me protected. I just love it. You just need to keep that material, put it in everything now.
We will take that feedback 100%. And there has just been so many progressions of UPF fabric and apparel, and it's been super exciting to kind of grow with the industry. I know when we started LUV 3 years ago, I guess it's almost 3 years ago now, there weren't even as many advancements as there are now. So it's just growing and progressing. And it seems every single year there are new innovations that we can tap into, which is very exciting.
Very cool. Well, I love it. And I've tried a lot of brands, like a lot. And that got worn along with your cover up, because that was super easy. You can cover whatever you want, however you need to. I love it. And it dries really quick if it gets wet. I don't know the name of it. The multicolored one.
The multi-coral wrap. Yeah.
Yes. Love it.
Yeah, that's awesome. Yeah, I know the wraps. I always have one in my suitcase. So whenever I go on vacation, it's ready to go. And then I always have one in my car, and I drape it across my arms when I'm in the car.
I keep one. Actually, I've kept yours in my car for a couple of years now for soccer and softball. So you'll see me in the fall, actually, for soccer. My kid does travel soccer. I have a River Ridge Dermatology SPF umbrella, and then my legs are covered with your leg wrap.
Oh my gosh.
If anyone sees me with that pretty purple polka dot, it's really cool pattern. That's where it's from.
That was probably the best message I got of all time when I reached out to you, because we're trying to grow LUV and we're trying to spread the word. And you said, I actually already have one of your products.
And I've had it for a while, and I don't know if I didn't. I don't know, because there's your logo is not on the actual item. And I think I threw out the box, and it's been a couple of years, and my Instagram was kind of dead for 2-3 years. I put it away. I had other things going on. And then when I saw it on Instagram, I'm like, wait a minute, I already know you. I already use your stuff. This is awesome.
That was so crazy. Yeah. Fun fact, when we first launched, we hadn't finalized the logo yet. So the first couple units, people were asking for us to sell. They're like, we want it. It's summertime. We want the product. We want the product. And I was like, okay, well, we haven't finalized the logo. So I guess we'll just sell the units as is. So our first maybe 100 units that went out didn't have the logo on it. So we're hearing that story. People are like, I don't know what brand this is. I'm like, oh no, we made a mistake.
You're fine. You just need to put on Instagram. It'll find you, apparently.
Yeah, that was a crazy story. I told Snigdha, I'm like, oh my gosh, people are recognizing the brand, which is incredibly exciting. And I'm still waiting for the day when I pass someone on the street who's wearing the brand. I will probably freak out and cry and get excited and ask for a picture all at the same time. So another thing, kind of going off of, sun safety and skin cancer awareness, is another thing is people tend to forget. This is not everyone. There are people who are very, very diligent, but I find some people forget to put sunscreen on their lips. they forget to take care of their lips and have all kinds of, their lips can burn and it is super painful. So let's talk a little bit about that and why people need to remember to apply sunscreen to their lips as well.
Yeah. And a lot of times people will sweat on the upper lip, especially postmenopausal women. Sometimes they sweat here, and then you have to remember to reapply. There are plenty of SPF lip applicators out there now. There used to be not very many. I mean, I used Delta MD at one point, and I was picky on having zinc. Pick one that you like. It goes back to pick one that you like. Now, my little pet peeve with them, a lot of them are SPF 15, and I really think they should be 30. So I think you really should look for SPF 30. I'm super picky. Some of them, I think I like my lips a lot, but so some of them give me heartburn. So you just kind of have to go through and figure out which one you like. And I change up all the time, and I'll probably have 3-4 different ones. I don't even know what's in the sunscreen bag right now. And if you're not sure and you didn't get one and you find yourself at the beach, whatever you're applying to your body, just apply it to the lips. And remember, often you're drinking because you're rehydrating. So reapplication to the lips should probably be about every hour.
Yeah, that's great advice. And I didn't even think about if you're drinking something having to reapply. That is a very good tip because obviously it just wears off just like normal sunscreen would. So remembering to reapply would be very important. So I think dry lips is also something people are experiencing right now because we're right in the middle of winter.
Yes, it's pretty bad, especially if you just had a lip flip like I did. So lips in the wintertime dry out like crazy for a couple of reasons. One, temperature drops, and then humidity drops, and then it's windy, so our lips get chapped, so we tend to lick them. It's a human nature. That's what we do. And then you really just make it worse. So here's some tips. At nighttime, and people will do I need to brush it? Do I need to scrub it? You really don't need to scrub your lips. The sugar scrubs, if you want to use your toothbrush after you're done brushing a little bit, you can, but I wouldn't pick anything off. At bedtime, I would apply Vaseline, plain Vaseline. And if your lips are extra dry and you have hyaluronic acid serum that you use on your face, a little bit of hyaluronic acid serum to your lips. Now, trick with the hyaluronic acid serums, all of them, is they should be applied to damp skin. So if you just wash your face and you're already dried, you can maybe get some of that La Roche-Posay spray and rehydrate, or you can just not dry your face. I'm terrible. I get out of the shower, I dry off. I'm like, oh, and then I forgot. So I'll spray first. Then I'll put a few drops of hyaluronic acid serum. And you really want to brush your teeth first and then wash your face so you get all the toothpaste, because leaving toothpaste around your lips will create further irritation, contributing to chapped lips. So the proper order at bedtime is brush your teeth, then wash your face.
Okay.
And after you wash, leave your skin damp, a few drops of hyaluronic acid on your lips and entire face, and then coat it with Vaseline. So things that, not just Vaseline brand, but Aquaphor, CeraVe Healing Ointment, anything with petrolatum in it at nighttime. I do it every single night, probably year round, definitely in the wintertime. And then during the day, I see people using Carmex. Oh my goodness. That has camphorphenique in it. That is a drying agent. It is just creating an addiction. So you apply it, it feels good for a little bit, but then it dried you out. It's addicting and creating further problem. So plain Vaseline for lips. And I don't like touching my lips with my hands throughout the day. So Aquaphor has a brand. Anything that has active ingredient of beeswax. Of petrolatum. I say beeswax because I'm going to bring it up. What's the brand I'm thinking of? Why am I forgetting it right now?
Is it Burt's Bees?
Yes. Thank you.
Oh, okay.
Wow. Talk about brain fart. So really good natural line. However, beeswax can be very irritating to patients with sensitive skin. The risk of contact dermatitis from beeswax is increasing, probably because we're overusing it. So if you're using your chapstick brand, which has a lot of fragrance, is also not good, or you're using Burt's Bees, let's say it's a fragrance-free one or the plain vanilla one, and your lips are still chapped, you probably need to get something with no fragrance and probably something with just petrolatum and no beeswax in the ingredients, because you are making the dry, chapped lips problem worse.
Interesting.
Those things.
I heard someone, this is like super, super random, but I was at Trader Joe's last weekend And I like some of their beauty products. I think they're great. And I was in the section picking up a couple of things, and I heard one of the people working there telling someone else, "Oh, you don't want to use X brand." I can't remember what it was. And they said, because it actually makes your lips dry out faster. And I was like, oh my gosh, am I using something like that? Like, I never even thought about a product that is specifically meant to hydrate your lips. Like, it's a chapstick. You think the purpose of it is to hydrate your lips, actually could be creating even more chapped lips.
So I would definitely avoid Carmex, anything with fragrance, and anything with beeswax. If your lips are chapped and you're using your chapstick, you probably have an ingredient that's irritating you.
Interesting. Snigdha, I didn't know that. Did you know that?
You learn something new every day. I did not know that. Yeah, I use the little, I think it's Vaseline. It's the little pot, the pink something. I forget what it is, but I've used it since I was in like middle school. So I'm going to go check the ingredients after this.
Yeah.
I mean, if it's not irritating, you like it, that's fine. But if you find yourself applying it 20, 30 times a day, it's probably irritating your lips.
So interesting. So everyone listening, go check your lip balms and make sure that you're using proper ingredients for you. Yeah. You also mentioned, okay, you posted about this on your Instagram story, and I was fascinated because I did not know that there was a difference between a lip flip and lip filler. And this is on a total tangent, but can you explain the difference?
Yeah. And it was a total random post too. I didn't plan on doing it, but I did pin it to my highlights. So if anyone's on my Instagram page, there's a highlight up there where I put stories that after I post them, I end up getting a lot of questions about. I just kind of put them up on the highlights. So I ended up doing a lip flip recently myself. So a lip flip is ideal for younger patients who already have lip volume and they just want their upper lip to be just a little bit bigger, just a tad bigger. So what we do during that procedure, it's quick. It takes 1 minute, if even that. There are 4 tiny, teeny injections on the upper lip that I would do, and they are right at the what's called vermilion border, and that's where the pink lip meets the skin color lip right there, and it's about 4 injections. And they look like little tiny bubbles, maybe for 15, 20 minutes. They go away, and then Botox kicks in. Gosh, anyway, from day 2 to day 10, everyone's different. I am maybe 2 weeks out from mine, so it's fully kicked in. But what happens is that muscle around your lips that is round and scrunches down and allows you to drink out of a straw gets so strong that your lips look smaller. So when you relax that upper lip muscle, it just kind of relaxes and pops up. Now, most of the time you can't drink out of a straw afterwards, but you really can. I just did it. Y'all watch me do it. I mean, it's not, you just have to focus and know that your upper lip is just a little bit weaker. It doesn't, so typical Botox lasts about 3 months. Botox in the upper lip is probably not going to last full 3 months because not many units are injected. But you don't want to inject more units because if you do, you lose the ability to speak and eat. And you kind of need that function. So I do mine maybe a couple times a year. I always don't like it from day 2 to 5. I go through like 3 days of, oh my God, what have I done? And then after that, I really get used to it and I love it. So it's really nice for those younger patients who really don't want lip filler. And speaking of lip filler, it's completely different. It adds volume. Fillers come in a syringe. If you push them out, it looks like squishy gel-like substance. So it is adding volume to the lips. It's not for everyone. And I really think we need to be more conservative with lips. This Instagram trend, and I don't mean that in a good way, it's getting out of control. I mean, we all want certain type, shape lips, and that's not the goal. You should love who you are. You should love your lips. You should just take them back in time to what they used to be. Not try to create something that you're not. It's creating body dysmorphic disorder. It really bothers me what's happening with the lips nowadays. So I love lip filler and I do it often, but there's the right patient and there needs to be the right injector and there's the right filler and the right amount of filler. So all that needs to line up just right for it to look normal. Otherwise, you're in a no man's land, Instagram-ish. Just not a fan.
Yeah, I think it's always super powerful to find a cosmetic dermatologist it's a medical spa that's attached to a dermatology brand, because I found with practices like that, they are more willing to work with you and how you are naturally versus doing something just because you want it if it's not going to work for your face. Snigdha and I have certainly seen the lip trends and everyone getting lip filler and all the celebrities doing that. And I mean, that would not look good on my face at all. I don't think I could pull off that look.
Same. And I tell my patients when they come in, I said two things. One, you should judge your injector skill by their face. Look at your injector. If you're like, oh, this is it, this is what I want to look like when I'm that age, that's your person. But if you're looking and they're out there, they either have too much or not enough, then you're probably not going to mesh well. And then number two, look at their before and afters. So always know your injector's credentials, look at them, and then look at their personal before and afters, not the before and afters provided by the company who sells the filler. The injector, real patients, real people. And if that's what you want, that is your person. If not, then not. I've turned away people over the years because they wanted something that I just didn't feel comfortable with. It's not my signature's natural look. And if that's not what you want, then we're not going to mesh well.
Yep.
That's all.
Yep.
Yeah.
What are some of the most popular treatments people come in for from an aesthetic side?
Botox,
Okay.
Dysport, Daxify are most common. Laser hair removal is extremely common.
Okay.
And then fillers. And for fillers, everyone wants lips. But you can't really get big lips if you have no volume in your face. If you've lost volume everywhere else and you're just correcting one area, everything has to be synchronous and look coherent. You kind of have to look at the whole thing. I have people come in, they just want lip filler, and they walk out with, this happened just the other day, they walk out with a recommendation to see plastics for eyelid surgery and a sunscreen and a retinol recommendation. I end up doing nothing because I just think that that's the best for them. That would be the best place to start.
Yeah, I feel like some people go too far too fast where they want all these changes. So they do instead of gradually to see how you like it, you go full all the way out from the very beginning.
Yeah, it's extremely rare for you to come in on my consultation. We do filler. Actually, that doesn't really happen. I always recommend, I said, listen, we're new to each other. We should do maybe a little bit of Botox if you want to do something. I always check Botox back in 2 weeks. And then if we agree that the results were good, it's in the budget, and it's something you're able to maintain, then let's take this further. I think cosmetics is kind of like, I call it like your hair and your nails. You either care or you don't. It's either you're going to make it in the budget or you're not, because it has to be budget friendly so you can maintain it. And you have to love the results. You can't just say they're okay. You have to love them.
Mm-hmm. Yeah, I think this just speaks to the quality of care and service that you provide, that so much thought is going into this. It's not just like I'm going to do it just to do it, call it a day, but actual care that goes into every single consultation and treatment and patient.
If you've seen me in the past, you know that first visit I tell you, I'm not here to sell anything. I'm a terrible salesperson. I'm here to get you to like something that I do so you want to do it again.
Mm-hmm.
The goal is that you love it, that you will want to come back for more. It makes no difference to me whether or not you do something when you first see me. None whatsoever. I just want you to love the result because my name is on your face is how I see it. Whether or not you tell anyone about it, which most of my patients don't, which is fine.
Yeah, I feel like you guys got to spread the love, and especially for listeners who are based in Blacksburg, which we know we have a huge audience around Virginia Tech, so Blacksburg and Christiansburg, because Snigdha and I both graduated from Virginia Tech. If you guys are listening, River Ridge Dermatology you probably have already heard of them because they are one of, I feel like everyone who went to Tech went to River Ridge because you guys are such a big practice with multiple offices. So if people are listening who are based in Blacksburg, or maybe people who are in Roanoke who are like, well, I don't want to go to Blacksburg, can you share about your offices because you guys have multiple locations?
We do. We currently have 4 locations. Blacksburg and Roanoke are our big offices. We have a small location in Narrows office, in Narrows, which is not open every day. And then we have a Salem location. And we are in the process of merging Salem and Roanoke. We are getting a bigger facility in Roanoke. So Roanoke office will, triple, quadruple in size, hopefully this fall. So all those Salem patients who probably hate the parking at the hospital right now, that's going to get better, guys. I promise it's coming. It's coming. So we pull quite a bit from Blacksburg and Roanoke. I work in both Blacksburg and Roanoke offices. Blacksburg, I see patients on Tuesdays and Thursdays, and I'm in Roanoke every Wednesday. And I book up pretty quick in Roanoke, but I'm the only female physician down there right now. So I get a lot of those patients. And I do most of the injections as well. So I get a lot of those as well.
Perfect. So again, if you guys are in Southwest Virginia, you have a convenient location and soon to be a very large location in Roanoke. Well, Dr. Brown, thank you so much for your time and for this conversation. And for anyone who's listening and they want to connect and they want to see your Instagram and all of these, these reviews and that you share on your Instagram, where can they connect with you?
Instagram is the best place to find me. I'm pretty responsive. My handle is Dr. Aleksandra Brown. And if you type in DRALEKS, it'll pop up. It's a European way to spell it. I'm on TikTok and Facebook as well. I check those, not as much as Instagram. I am responsive. If you have questions about general skincare, send me a note. I'll turn it into a video, especially if I get several of those. No medical advice on Instagram, though, but I'm happy to give general skincare tips.
And we'll share all of these links to your social channels and to River Ridge Dermatology in the show notes so that people can easily click those and connect with you. But Dr. Brown, thank you so much.
Great. Thank you so much. Thanks for having me.